Walsh was a young nurse who lived in a 2-story house with her parents in Pittsburgh, Pennsylvania. She had 2 jobs, a full-time job in the emergency department and a part-time job as a nursing tutor. She took pride in her love for science and decided to name her 2 small Pomeranians, Pen and Vanko, after 2 types of antibiotics, penicillin and vancomycin. One day, after wrapping up a tutoring session, she went straight to the emergency department to do a night shift. In the early morning hours of her shift, a patient, Parviz Elegin, was brought in by his husband. Parviz's skin was covered in hives, his face was swollen, and he was having difficulty breathing. Dr. Arturo Reyes screamed from the other side of the room, "He's got severe anaphylaxis! Let's grab the crash cart! We need the endotracheal tube, epi, and IV fluids. Nora, I need your help on this." Nora left her coffee and rushed over to get the crash cart. A few seconds later, she was at the bedside, quickly opening up the drawers to get access to everything and rubbing her hands together with hand sanitizer. "Here you go, Doc," Nora said as she passed the endotracheal tube to Dr. Reyes. "Nora, I need you to—" Dr. Reyes was trying to tell her something while he was struggling with the intubation. It was clear. The patient's larynx was too narrow for this size of the tube. After several failed attempts, Dr. Reyes pulled out the tube and said, "Nora, I need you to get me another tube. We need a smaller diameter." Nora rushed. A few minutes later, the intubation was complete and everyone in the room took a collective deep breath. But Parviz was still critically ill, and his blood pressure was starting to drift down, a worrisome sign of shock. "Give him 2 milliliters of epinephrine," Dr. Reyes ordered. Nora looked at Dr. Reyes in a strange way, like something was clearly wrong, and she asked, "Are you sure, Dr. Reyes?" "Yeah, let's do this. He needs epi in his system, and if he doesn't respond, then I want you to give him 2 more. Nora grabbed the vial of epinephrine in the cart, which had a concentration of 1 to 1,000, and delivered 2 milliliters, which works out to a dose of 2 milligrams. A couple of moments later, the patient began to experience chest pain and heavy breathing. His blood pressure shot up fast, 200 over 120. Nora and Dr. Reyes looked up at the ECG monitor and saw the same thing. "He's experiencing severe tachycardia. We need to do something," Nora shouted. Unfortunately, the rapid change was too dramatic, and within moments the patient had died. Dr. Reyes stared in shock and realized that he had said 2 milliliters, but that he had assumed that the vial of epinephrine had a concentration of 1 to 10,000. He had wanted to give a dose of 0.2 milligrams rather than 2 milligrams. He had ordered Nora to give 10 times more epinephrine by mistake. Nora and Dr. Reyes explained what happened to Parviz's husband Ilan, who was stunned and horrified.